This is about much more than trying to fulfill campaign promises, I think. Simply put, the Affordable Health Care Act is not affordable. It's failing the people, the very people that promised to help. Insurers continue to pull out, limit coverage in states. They are requesting dramatic premium increases again for next year. In Kansas, premiums have doubled since the law have been in effect. Next year, if we assume all the plans that have filed rates in the state sign that final contract in the next few days, all Kansans will have just two options of insurance carriers on the exchange, and one is on a teeter-totter. They may also face premium increases of up to 29%. When I was back home at the State Fair in Hutchinson, Kansas, just a couple of weeks ago, there was nothing but concern and frustration, and yes, anger from my constituents over the law's failures and questions, if not demands, as to why we here in the Senate have not successfully passed reform. Now, I do believe, as has been pointed out, that we reached bipartisan agreement that the law is not working. Over in the Health Committee, it's been pointed out, we've held numerous hearings over the past several weeks to review proposals to address premiums instability in the individual market next year. Unfortunately, many of our colleagues simply wanted more money to patch this problem, not proposals to address many of the law's fatal flaws. There is another alternative out there. Longtime champion of single payer, Senator Bernie Sanders, has recommended Medicare for all, government-run health care, and has reintroduced his proposal with 16 senators of my friends across the aisle endorsing that idea. I am continuing to review the proposal before us from Senators Graham-Cassidy and others, getting feedback from actuaries, the Congressional Budget Office, and most importantly, Kansans. What I am positive of is that this proposal that we have before us certainly is better than socialized medicine. Senator Cassidy, one provision that is included in your proposal and many of the other proposals Congress has considered over the last year to address the increasing growth in the Medicaid program. I'm being repetitive, but I think it needs to be repetitive, and that is switching from an open-end entitlement to what is known as per capita caps. Would you constitute such a reform proposal where spending continues to increase every year as slashing the program?
No.
While its inclusion in the debate surrounding the Affordable Health Care Act has led many to believe this is a Republican-only idea, it is not. It was actually something proposed by former President Clinton, embraced by former Chairman Baucus of this committee, then Senator Biden, and Senator Patty Murray. Our Kansas Medicaid folks tell me they estimate Medicaid spending in our state to increase 3% a year over the next few years. Senator Cassidy, what is the growth rate in your proposal for my state?
There's two aspects to your state. In the traditional block grant, if you will, you're going to Kansans will have lots of money for cancer screening, et cetera. In Kansas, you'll go from receiving $2.9 billion from 2020 to 2026 under current law. Under our proposal, you would get $4.7 billion from 2020 to 2026 to provide cancer screening and cancer treatment for lower-income Kansans.
Is it fair to say the Kansas cap is, in fact, higher than what they currently spend?
Yes, you can spend, you can also supplement, if you will, the traditional Medicaid budget with the extra dollars that Kansas is receiving, and you have the flexibility to do that as well.
Let's go to the yes or no questions, but you can cheat on that a little bit. Are dependents up to 26 still allowed to remain on their parents' plans?
Yep.
Will mental health parity requirements still be in place?
Correct.
Let's say a state does submit a waiver to redefine the essential health benefits. That's been a concern. Got to get the glasses up. Sorry to Ms. Miller and to Ms. Mann. Would prior state mandated benefits still be in effect, or are we looking at a Wild West, something like some are claiming?
No, states, there's the supposition that governors are not going to take care of the people in their state, which kind of underlies all these questions by some who oppose the bill. I disagree. I think governors want to take care of the folks in their state. But if they apply for a waiver, the statute specifically says that the governor must establish that those with pre-existing conditions have access to, quote, adequate and affordable coverage. If they fail that, there's a provision in which the Secretary of HHS can pull dollars back, both deny and pull dollars back if they misuse the funds by not providing access to adequate and affordable coverage.
Senator Carper.